Why is your vagina itchy? Itching in the vaginal area is a bothersome and occasionally severe sensation that can be caused by irritating chemicals, infections, or menopause. It can also be caused by certain skin conditions or sexually transmitted illnesses, STDs. Vaginal itching can occur in rare situations as a result of stress or vulvar malignancy. You are welcome to Health Place. For more videos on healthy living, kindly subscribe and hit the notification bell. The majority of vaginal itching isn't a reason for alarm. If the itching is severe or you feel you have an underlying issue, you should see your doctor or gynecologist. Through an examination and tests, your doctor can establish the source of your vaginal irritation. They'll also be able to suggest therapy options for this bothersome ailment. Causes of vaginal itching. Here are some of the possible causes for the itchiness of the vagina and the surrounding area. 1. Irritants. Vaginal itching can be caused by exposing the vagina to irritating chemicals. These irritants may cause an allergic reaction, resulting in an itchy rash that spreads throughout the body, including the vaginal region. Among the most common chemical irritants are soap, bubble baths, feminine sprays, douches, topical contraceptives, creams, ointments, detergents, fabric softeners, scented toilet paper. Your urine may also lead to vaginal discomfort and itching if you have diabetes or urinary incontinence. 2. Skin diseases. Certain skin conditions, such as eczema and psoriasis, can induce genital rot and itching. Eczema is a rash that arises mostly in asthma or allergy patients, also known as atopic dermatitis. The rash, with a scaly appearance, is crimson and irritating. In some women with eczema, it can spread to the vagina. Psoriasis is a widespread skin ailment that causes the skull and joints to grow scaly, itchy, red areas. Sometimes similar symptoms may also develop in the vagina. 3. Yeast infection. Yeast is a natural fungus, which usually occurs in the vagina. It does not generally cause difficulties, but a painful infection can occur if its growth is uncontrolled. This ailment is characterized as an infection with vaginal yeast. This disease is highly frequent and at some time in their life affects 3 out of 4 women. The infection commonly arises after using antibiotics, which can eliminate beneficial bacteria and harmful bacteria in these sorts of medicines. To control yeast development, beneficial bacteria are needed. The overcrowding of the yeast can lead to discomfort, including stinging, burning and lumpy flushing. 4. Bacterial vaginosis. Another prevalent cause of vaginal itching is bacterial vaginosis, BV. BV is caused by an imbalance, similar to a vaginal yeast infection in the vagina, between healthy and harmful bacteria. The disorder is not usually symptomatic. In symptoms, vaginal irritation and an odd scent discharge generally occur. The flush might be narrow, slender and white or gray. It might also be foamy in some situations. 5. Sexually transmitted diseases. Several STDs can be spread via unprotected sexual contact, causing vaginal irritation. These includes chlamydia, genital warts, gonorrhea, genital herpes, trichomoniasis. STDs can also cause additional symptoms, including abnormal growths, green or yellow vaginal discharge, and pain while urinating. 6. Menopause. Vaginal itching is more common in women who are going through or have previously gone through menopause. This is related to a decrease in estrogen levels after menopause, which causes vaginal shrinkage. This is a mucosal thinning that can cause extreme dryness. If you don't seek treatment for the dryness, it might create itching and discomfort. 7. Stress. Vaginal itching and irritation can be caused by physical and mental stress, however. This isn't particularly frequent. It might happen if your immune system is weakened by stress, making you more susceptible to infections that cause itching. 8. Vulvar cancer. Vaginal itching can be a sign of vulvar cancer in some circumstances. This is cancer that starts in the vulva, which is the exterior region of a woman's genitals. The inner and outer lips of the vagina, the clitoris, and the vaginal aperture are all included. Symptoms of vulvar cancer are not always present. Itching, irregular bleeding or soreness in the vulva region are some of the symptoms that might develop. If your doctor discovers vulvar cancer early on, it can be effectively treated. Another reason to see a gynecologist every year is to avoid complications. Home remedies for vaginal itching. The majority of causes of vaginal itching may be avoided by practicing excellent hygiene and adopting healthy living choices. You may avoid vaginal discomfort and infection at home by doing the following. Use warm water and a gentle cleanser to wash your genital area. Avoid scented soaps, lotions, and bubble baths. Avoid using such products as vaginal sprays and douches. Change out of wet or damp clothing right after swimming or exercising. Wear cotton underwear and change your underwear every day. Eat yogurt with live cultures to reduce the chance of getting yeast infections. Use condoms during sexual intercourse. Always wipe from front to back after having a bowel movement. When to see your doctor about vaginal itching. If your vaginal itching is severe enough to interrupt your everyday life or sleep, you should consult your doctor. Although the majority of reasons aren't dangerous, there are several therapies that can help relieve vaginal itching. If your vaginal itching lasts more than a week or happens in conjunction with any of the following symptoms, you should see a doctor. Ulcers or blisters on the vulva. Pain or tenderness in the genital area. Genital redness or swelling. Trouble urinating. An unusual vaginal discharge. Discomfort during sexual intercourse. Lastly, please feel free to share in the comment section your experience so we can learn from it.